and clear. So ideally we make extra space. Okay, you're dispatched for a 68-year-old male with difficulty breathing. You walk in, he's sitting forward in a tripod positioning, elbows on his knees, pursed lip breathing. You hear wheezing before you even get close. He says, "I just can't catch my breath." He has a long smoking history, uses home oxygen, has an inhaler in his hand, respiratory rate is 28, SpO2 is 86% of room air, heart rate 104. What are you thinking? This should point you toward an acute COPD exacerbation. Now let's break it down. COPD, chronic obstructive pulmonary disease, is most commonly caused by long-term smoking. It includes two main problems: chronic bronchitis, where the airways are inflamed and filled with mucus, and emphysema, where the alveoli are destroyed and lose elasticity. Here's the key pathophysiology. In emphysema, the alveoli lose their stretch. Air goes in, but can't get out effectively. So air becomes trapped. Lungs hyperinflate. Gas exchange decreases. Because surface area is lost, carbon dioxide builds up. Oxygen levels drop. In chronic bronchitis, swollen airways and thick mucus further block airway. So now you have airflow obstruction, poor ventilation, VQ mismatch, hypoxia, and sometimes hypercapnia. Common signs and symptoms include shortness of breath, especially on exertion, wheezing, prolonged expiratory phase, pursed lip breathing, tripod positioning, chronic cough, barrel chest in long-term patients, possible cyanosis. So what do you do as an EMT? Start with your primary assessment. Is the airway patent? Are they ventilating adequately? Apply oxygen, but titrate carefully. GO SpO2 is typically 88 to 92% unless local protocol says otherwise. Assist with their prescribed inhaler if indicated. Consider CPAP if they are in moderate to severe distress and can follow commands. If ventilation is inadequate, assist with a bag valve mask. Monitor closely, and remember, these patients often retain carbon dioxide. So your focus is improve oxygenation, reduce work of breathing, support ventilation, and transport. The takeaway: COPD is a chronic disease with acute flare-ups, air trapping, mucus, loss of elasticity. Recognize the signs early, treat hypoxia, support ventilation, and reassess constantly, because respiratory fatigue can sneak up quickly.